What's up, y'all? We back with another vid. Welcome back to my channel. Thank you for tuning in and watching this video. Before I get into today's content, I just want to say I am being consistent this year. I promise. You're gonna get a lot more content, a lot of tips, advice, just anything that I think is important and anything that you guys will recommend to me. I will definitely be doing more videos. I promise. 2022 is a different type of year, okay? So just get ready for that and get ready for the content. And stay tuned, like, comment, and subscribe. So today's video is going to be about my experience as a male nursing student, the pros and the cons that I think are important to mention, were there any limitations, and just discussing like the different gender roles that we as male nursing students have that are different from the females. Okay, let's get right into it. So first we're gonna start off with the pros. All right, so my first couple of pros about my experience being a male nursing student are being able to connect with minority patients. I feel as though me being mixed race, it's easier for me to connect with minority patients, especially male patients. Just connect on that level, the unsaid level of just knowing what somebody needs and just being able to know what they don't understand and what they do understand, and just the subliminal cues, of different cultures. I'm able to just be more sympathetic in that way, and just be able to connect with them on a different level that's, comforting for them and comforting for me. So I know that we're giving them the best care they can. And this leads me into my next one, being able to advocate for them. As you know, there's disparities in healthcare, especially with African-American men and women. So I have firsthand seen the disparities and the discrimination. I go to school in South Georgia, so I'm right there. I know, I can see, I know what it is, okay? And I didn't know until I was able to be submerged in the clinical setting what disparities were, especially with the African-American population. But being able to see that and know that that is not okay has given me a more positive outlook on what I want to do, how I want to be impactful as a nurse when I become an RN and practice on my own. And now being able to know that I can speak up for them if they're not able to speak up for themselves. And just to give you an example of what a disparity could be, like pain management. We know African Americans are treated less than other races when it comes to pain. Doctors take them less serious, and it could be the nurses take them less serious and don't prescribe them high doses due to the high addiction rates of opioids and just narcotics and all of that. So being able to gauge that and know that it's okay for someone to ask for more medication and not see it as something as they're abusing it. Throwing out the prejudices and the discrimination and just focusing on the patient without color coming into play. So just being able to know that, and to know that that's a thing, and to be even more of a change for that factor. So my last pro is being able to navigate male patient care. It is way easier in some cases, not all, to interact and just do what you need to do as a nursing student with a male patient, because you don't have to go through all the obstacles you do with a female patient. Not to say that I don't enjoy doing that or that requires more energy. Just to say it like it is, we don't have to go through all the obstacles of asking permission to do certain things, and we kind of already get the feel of what their preferences are. So we don't have to go through all the obstacles of just maybe having somebody come and shadow with us while we go in there, or asking permission to do certain things. Okay, that's what I mean by navigating male patient care, which is pretty self-explanatory, but I thought I would mention it. So that were all my pros, and now we're going to move on to our cons. Okay, next we're going to talk about our cons and limitations of my experience of being a male nursing student. So first and foremost, in the clinical setting, when we have female patients, we have to ask permission before doing any intimate procedures, like in your private areas, or being present for bed baths. Like I know for me, I would hear the nurses all the time, and my instructor, as they should, ask the patient, are they comfortable with a male nursing student being present for this procedure, whatever it was. Some said yes, some said no, more said no, that they were more comfortable with a female. And I didn't take any heart to that, because I get it, I understand there's the gender roles at play, and some people are just more comfortable doing that, and some people are more open. So it's just dependent upon the patient, but just be ready for them to say no, okay? Because most people especially in the South, they really want a female nurse for procedures that are the private area. And these procedures could be like Foley catheters, bed baths, like I mentioned, looking at an incision around their perineal area, their private area, anything like that, or even going to the bathroom. So sometimes they would like you to step out, or they'll just want a whole female nurse to come help them, or they might want you to step out of the room while they do their business, just help them get there and just be there as a listening ear to make sure they don't fall or anything. So my second con is being asked to turn patients frequently. As males, we know we're societal standards, we're the strong ones, we're the ones that need to lift, we're the ones that need to carry the groceries, we need to do all the heavy lifting, you know what I'm saying? And there's no problem with that. I don't think I would say it as a con, but it is something to know. I mean, it's common sense as well, but you know, there's some nurses that are itty bitty tiny, and you know, I would not want them picking up a 300-pound man. So just be ready to be pulled in different directions if they need help lifting or moving patients, getting them up, sitting them down, turning them, whatever it may be. So my third and final con, or I would call it a limitation, it's not really a con, but is interacting with postpartum patients or antepartum patients or labor and delivery patients. And these are mothers who are about to have their child or having their child or have had their child. From my experience, when we did clinical in the postpartum unit, we'd have to do our morning assessments, and my instructor would want all the male students to make sure that we take her in there with us when we do our assessment. So she would be alongside us, shadowing us. She would go in there with us. And for the female nursing students, they could go in there themselves. They could do everything themselves. But we had to have our instructor. And especially when we did the fundal assessment, where we're filling up on her belly, making sure her fundus is contracted and not boggy, she would usually find it for us because it's very painful for the mother. And we would go right behind her and do it. Looking at it side by side from a female perspective and a male perspective, the female would have to do all of that by herself, while the male nurse would have to do it with an instructor. And looking at her private areas, the instructor would usually do that just because we know pregnant women are usually not in an altered state of mind. So there's no need for us to look. They can tell us if there's something wrong, and our instructor is looking already. And another thing about clinical on the OB floors, I went to postpartum, labor and delivery, and antepartum, and the nursery. But the one thing I noticed about all of those, there were like no male nurses. And if you think about it, you would think, okay, there's not supposed to be, but there is male nurses in that field, and I respect them, and we should honor them, because that is an environment we're stepping into that's not been traditionally worked in by males. That's one thing I did notice, and I have seen male nurses, especially, I know I've seen this one dude on TikTok. He's a male nurse, and he's a male travel nurse. He looked like very into it, very happy about it, and I was just like, wow, this is crazy. I just thought this was like a danger zone, like, no, don't come here. And it can feel like that when you go into clinical there, if you do, because there's a lot of females. The only men I did see were like doctors and PAs, anesthesiologists. But you may feel like I don't belong here, but as long as you do what you need to do, you'll get comfortable with it. You won't even think about it, and it'll be all good. All right, y'all, that was the end of this video. Those were my pros and cons and some in-betweens and some limitations that I experienced while being a male nursing student. I'm sure these will change as I get more into the profession, as I graduate in May. And start practicing. I'm pretty sure these will change, and I'll have different things to talk about because I'm not really fully submerged into it yet. But for now, that is what I have. I appreciate you for watching. I hope this could help somebody. And if you can relate, let me know in the comments. And if you want me to do a certain topic or a certain advice video, leave it in the comments. I got you. Y'all like, comment, and subscribe, and share with your friend. I wish you luck if you're going into nursing school. If you are a nurse, I appreciate you. And if we're just here for fun, okay? And I will see you in the next video.